Welcome back to the new norm. I'm Dr. Lou Graham. This is brought to you by Midway Dental and Catapult Education. This is part 2 of my Smart Mirror episode. We're going to be joined with Dan Harkabi's wife Yael, and again Josh, an orthodontist in Israel, is joining us again. So just to recap the first kind of first interview, Smart Mirror to us is an amazing technology that allows us really to almost live stream a patient, communicate in the chair with them, let them see what's going on, and with illumination from a mirror that really doesn't fog up, with a microchip computer, a microchip camera right in the center, and a voice activation handle that allows you to transcribe. Now you have all this technology, and we talked about how the new norm recall exam will change, how post-op exams will change. So I'm going to go right into Josh first. Josh, when in my world now, my world as a general dentist is when I do my workup, I take a cone beam routinely and digitally scan patients and take whatever other diagnostics. I then want to send this information out to my specialists, and with Smart Mirror, I can almost do a video walkthrough of what my findings are and send them to my specialists. This saves a patient an enormous amount of time. And it could be whether a patient needs a root canal, and here's a cone beam, and I send that to the patient. I send that to the specialist. But here's a video of me transcribing and then walking my specialist through the CBCT or my clinical findings. How are you using this right now, whether post in the pandemic or pre-pandemic, in the same way, if I can ask?
Well, Lou, I think it's not almost a virtual consult. It's absolutely 100% virtual consult. Every patient encounter, every time mom has to bring little Johnny to the office, they're doing a risk analysis evaluation. Is it worth it for us to go out with all the risks that are inherent these days versus the benefit of coming to see Josh? For whatever reason, they decide that it's worth it to come see my office.
Okay.
They feel comfortable. We've worked really hard to get them in that frame of mind. But now if I need to get a consult with the referring doctor, the referring dentist, have I opened up enough space for the lateral incisor implant?
Right.
Up until recently, what I would do is you take a picture, you write a letter, send them out, they come back 2 weeks later, you bring them in, everyone's happy. But now I don't want to send the patient out because I don't want to have to repeat my procedure. They for sure don't want to go to another office because they're just nervous. So what we do now is we get the referring doctor, hopefully if he's available or she's available, we get them on my phone and I have them in my ear. We get them to share my iPad with Zoom or on another sharing app, and they can see the exam real time, exactly as I'm seeing it. And we discuss the case with the patient sitting in my chair. It takes about a minute, 2 minutes to get this set up, but it can save a lot of time and hassle and travel for the patients. So we can do that real-time consult.
Okay.
I've run this with a number of specialists,
wait.
and they say about
Josh,
8.
Josh,
yeah,
let me, and then we'll get back right to that. So let me understand that the patient's in the chair. You're examining the patient with Smart Mirror and obviously videoing everything. How are you getting that specialist or that referring doctor to come in live? Walk everybody through that.
Okay, so there are two options. If the doctor's available, I start a Zoom session on my iPad. The doctor logs in and I share my screen and they see exactly what I'm seeing. They see the Smart Mirror app live. They see the video feed real time.
Right.
That's in the situation where the doctor's available. Right. But if the doctor's not available, all I do is I record the session, I dictate my note, I wrap that up, and I have my staff email that link to the Smart Mirror cloud server to the doctor. They can look at it at their leisure, and we can discuss the case that evening or another time.
So for the listener of this, of this interview, how hard was it for your team to start understanding how you could utilize this technology to communicate, with the downloadings and sending out the emails and the Zooms? To me, it sounds pretty simple. Is it relatively easy?
It was definitely see one, do one, teach
Okay.
one. If someone can scroll and open an iPad app, they can do this.
It's amazing. Okay, I interrupted you. So you were talking about other specialists.
So what I did, one of the things I did to keep myself busy in the past couple of weeks is I ran virtual consults with a number of different practices in my area, ranging from GP to perio, endo, oral surgery. And the feedback I got was that about 80% of them would feel comfortable giving the virtual consult as opposed to having the patient physically in their
Right.
chair. And 80% is pretty good for these days.
That's amazing. I mean, and you think about, not only are you playing the patient in more safety because they don't have to go to multiple offices and the time savings, but you're also saving the time at those offices that they don't have to get that patient in. I mean, I see this, that's why I see this as changing so much of the workflow. And yes, it's been fast forward because of the pandemic, but Josh, I see it even with vaccine and everything else. Why would a patient want to take a drive to another office with these kind of technologies and the ability to communicate? Your thoughts?
Absolutely. I agree 100%, Lou. Especially when our schedules might be a little bit backed up. The cost of having to reappoint an exam just for 30 seconds, a minute, 2 minutes of work, it just doesn't make any sense. And we can take care of it now, instantly. It's just, that's win-win for everybody.
And so with the doctors that you're working with, would you see pretty much everybody starting to implement Smart Mirror then in their offices so they can communicate with you the same way, so that you're actually more prepared when those patients, those referrals are coming in? Do you see it both ways?
Right. I think early on, I think it's a bit of a personality issue. I think you have the early adopters, those that are really excited by using and leveraging new technology, and there's still a few that are using chemical processing of X-rays.
I know. Well, forget them. I mean, that's they'll figure this out in 2040. But I get what you're saying 100%.
But I will tell you, there's been a lot of excitement in my dental community. The people that I've showed this to,
mine too.
They're waiting for it for sure.
So now I'm gonna flash forward to Dan's significantly better half, Yael. Welcome, Yael, to the show. It's great to have you. Miss seeing you live. So Yael, I now want to bring the world to the pandemic. You and I are both wearing face shields, the N95s or the KNs, and it's an exhausting procedure. And loops and lights, loops and lights, they have their own issues with these face shields and how they fit and everything else. Okay, I want you to take me in your world because you're seeing patients every day on an emergency basis. Walk me through the safety issue and how much better you feel every day using this, really replacing your old mirror into this. Walk me through it in your words.
Okay, so first now with the COVID-19, as I see many patients, mostly emergencies, I try not to be in their face, in the front. So I'm sitting the back, and I don't have to wear my loops as well, so I don't have to adjust them all the time, because every time first you cannot have a loop, but if you're having a loop and you don't have a face mask, this is the most contaminated device we have in the office. But anyhow, now I don't have to wear my loops, and I can sit behind the patient, or if I want, I can sit at the side, but I look on the screen. So when I look at the screen, I'm much further from the
Yeah.
patient's mouth and all the aerosol he's having, and still I can really see very well and watch everything. Now I'm using the smart mirror, so it's like having a microscope without using the microscope.
So let me interrupt so everybody understands what you're talking about. With the smart mirror now, you're looking at the projection, whether on a monitor in your office or on an iPad, you're looking at that while you're working, so you have better posture, you're not staring into the face, and you can see much better because of the automatic zoom of the smart mirror. Is that what, so it's kind of live, you're looking at the, your iPad or whatever to see what you're doing. Is that kind of a summary of how you're using it clinically?
Yeah, exactly. That's how I'm using it now.
So you'll go from showing a patient, in other words, demonstrating something to a patient, communicating, to actually using this in the safest possible way by then mounting your iPad on whatever system, and you can visually now see what you're doing. That's really, so it's really dual purpose in that patient appointment, beyond even communicating them over email, correct?
Correct.
So what other pearls? Yeah.
And one
yeah.
more thing that because smart mirror has light, I don't use the unit light, so I don't have to touch another thing in my office. Now everything you touch is another thing you can contaminate. So I'm not using the light. I'm just using the mirror all the time.
Right, so basically the old mirror is gone, your light's not really necessary anymore, and with the face shields, this has really allowed you a much better alternative to feel comfortable both not directly looking into the aerosol zone, so to speak, but to kind of work directly but indirectly on the patient.
Definitely.
Yeah, it's okay. What else would you want to tell me about, beyond obviously the communication, which Josh and I have already covered? It's a great communication tool. Now it's a great tool to use while we're working. Any other pearls that you would like to bestow, because you've used this, God, hundreds and hundreds of times now?
Well, the communication, as you said before, is with other doctors, but it's also a great communication with the patient, because you can really explain, and sometimes one picture worth 100 words, so you don't have to explain a lot to the patient. You just show him or her what should be done, and it's less time. And now we try to work as fast as we can, and especially with the COVID, not have them a lot of time in our office.
I'd like to say one more thing about the communication aspect. I found that Smart Mirror is an invaluable resource to treat my developmentally challenged patients. The iPad is a world that they all know. They give them the iPad and they let me examine their teeth. And for some reason, my Smart Mirror is not in my office. If I've lent it out to somebody, I won't see those patients that day. It's that much of a game changer.
Wow, I love it. This is great. So, I love the synopsis of this interview for this. And so, Dan, let me ask you this. Visions that we haven't covered in our first 2 episodes. Any additional visions that you'd want to share with the people who are watching and listening to this broadcast? Dan, come in.
Hello. Come in.
Have I lost Dan?
Yes, Lou. You've got me.
Okay.
I'm here
You
with you.
sound like you're in a tunnel.
No, I'm here. Maybe it went to the other... I'm fine, I'm here with you.
Okay. So,
Did Yael tell you that the hardest thing that she had to cope with me now for 3 weeks?
So Dan, any additional vision? There's so much coming, I know, that we can't talk about, but anything that in these first 2 episodes we haven't nailed?
I think the most important that we've realized that we also need to bring it to a price that can be used by every
Yes.
dentist on every treatment. Not making it something very exclusive, expensive that you have to worry about. And with generation 1, it's one piece. So if it falls down, it breaks, it's $1,500. People are scared. With generation 2, the smart mirror head will be probably $300. So this is it's a game
Right.
changer. Every dentist, every hygienist can have it.
Right.
And that's the goal, even if, we're making a very slim profit. So that's the main thing. We're trying to get it as fast as we can because we need to keep, our dentists safe. They are at the front line. They are the new soldiers, Then dentists and doctors in the hospitals, we need to protect them. And I think that smart mirror, keeping them away from the aerosol, allowing them to work quickly. They don't need to touch things. They can totally kind of having it as a last mile, as the first aid kit, remotely treating and having a tele-dentistry solution is what we need to support dentists in this new era.
Right. Dan, I love it. Listen, Dan,
Okay.
listen, 4 years ago, I knew this would happen. I knew you'd bring this to the marketplace. We brought many great friendships to this. And part of the disruption of Midway Dental is I introduced you to Midway Dental, and that's who will be distributing this and supporting this along with Smart Mirror Inc. So I think it's a great partnership going forth as we continue to navigate this pandemic era. I can't thank Josh you enough for your time, Yael and Dan. I wish you safety and just my blessings with all 3 of you. This is Lou Graham for The New Norm. Thank you all very much. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.